Good evening. Welcome to this webinar on the role of field epidemiologists in advancing public health practices. Welcome to all participants to this webinar. I invite you to use the question and response button if you have a question. Today we have three experts from our region who will talk about their experience in the domain of field epidemiology. We will introduce them one by one when they will present their presentation. The objective of this webinar is to highlight the importance and significance of field epidemiology in improving public health practices, to raise awareness regarding the impact of field epidemiology on people's health, and to showcase the lessons learned from FETP residents and graduates' role as frontline responder to the COVID-19 pandemic, and to recommend ways to empower field epidemiology further. As you know, as public health workers worldwide have been involved in COVID-19 pandemic response effort, field epidemiologists have been at the front line of this effort, specifically in contact tracing, case investigations, community engagement, data collection, and analysis. This has helped increase the visibility of FETPs and make them more involved in all of the pillars of public health. The light of these events, the training programs in epidemiology and public health and intervention network DEFINET commenced the first World Field Epidemiology Day on September 7, 2021. The goal of this global movement is to raise awareness of the vital role of field epidemiologists in advancing global health security to protect the health of populations. It serves to advocate for increasing the investment in field epidemiology, research, and professional, and it also recognizes the research conducted by FETPs as well as other public health professionals. The occasion is observed on this particular day because it marks John Snow's presentation on this finding about the cholera outbreak to local authorities in London in 1854. This is considered a key event for modern epidemiology and public health. Today, there are 75 FETPs around the world. Training field epidemiologists is more than 100 countries worldwide. More than 19,000 field epidemiologists have graduated from an FETP. The effort the FETP resident and graduates made during the pandemic contributed to raising more awareness to the important role they play in the elevating public health standards in their respective countries. However, this awareness did not translate into more funding for FETPs or the research of residents and graduates. This day served to fill in gaps of visibility and to increase the prominence of the role played by field epidemiologists in public health practices. In recognition of this day, GFG AmpNet proposes holding a special webinar within the AmpNet WEBi series that brings together field epidemiologists to highlight the importance and significance of their work in advancing public health practices. Today, we will have the opportunity to have three experts from our region who will share with us their experience. And we will start by Dr. Haytham, who will share his experience on the future of FETPs. Dr. Haytham Bashir is the Workforce Capacity Team Leader at GFG AmpNet. He is also the Executive Director of the International Academy of Public Health. He served as an assistant professor at the School of Medicine, National University in Khartoum. Prior to these roles, Dr. Bashir worked as the Director of Teaching and Education at the Public Health Institute, Sudan, and the Director of the Emergency and Humanitarian Action Department, Sudan, till 2010. He has experience in designing and implementing education and training programs. He has published work in emergency management, capacity building, and training. Dr. Bashir holds a PhD in disaster management, a master's degree in public health, and in MBBS. We have the pleasure to have Dr. Bashir with us today to talk about his experience in and to advise on the future of FETPs. The floor is yours, Dr. Bashir.
Thank you, Dr. Nisaf, and good evening, good day for you all. It is my pleasure to share this webinar with two eminent resource persons and experts in our region, Professor Nisaf and Dr. Abdul Wahid, and with my colleague Dana Shalabi, the team leader for knowledge exchange and networking at MFNet. So I will try to be brief in my presentation, and I'm sure that most of the points that will be raised in this webinar will bring in hot discussion, and I expect 50-50 agree and disagree. So I'm going to start my presentation with a brief background about the importance of FETP and what have been done so far in our region. In addition, I will try to share with you some of my expectations, or some of them are dreams, you may say, and then together we will discuss how to achieve those expectations. So I think by now, no one argue the importance of FETP to our countries, especially for this region. And the FETP has proven itself as being not just a training program. It goes beyond that. The value added by this program extends to cover a wide spectrum of public health functions and services across our health systems in the region. The FETP also provide critically needed public health and global health security services, as you know, through well-structured training model, mainly learning by doing approach, and that improves the effectiveness of the workforce and health systems in order to enable them to provide those services. The FETP also has proven its value and significant role in supporting the, as I mentioned, the health system, and to reach universal health coverage. In this region, we all witnessed the success and the essential and critical roles played by our FETP residents and graduates in supporting the national efforts in managing the recent COVID-19 pandemic and other public health emergencies and outbreaks. As Professor Nisaf mentioned, the support extended throughout the surveillance, data management, and other components. So if I may share with you what I consider milestones in the journey of our FETPs in this region, I may present them in those four categories. Throughout the last decade, we at the Eastern Mediterranean region managed to establish new programs as well as supporting the existing ones. And by as of today, we have the FETP in 13 countries with different modalities. So we may also report that we have 25 FETP levels, because some of the countries, as we'll show you shortly, have more than one tier of the FETP. Also, one of the milestones milestones that we managed together with our countries to achieve is to customize the standard curriculum to match our context and needs throughout the different, again, FETP levels, ranging from the basic, intermediate, and the advanced level. We have been providing the technical support in the form of training of mentors, trainers, supporting countries to evaluate their programs and facilitate their accreditation. And over the last maybe 3 or 4 years, we, again, together with countries, started to think about institutionalization of those programs in order to ensure their sustainability. During the pandemic, or the last 2 years, again, we have managed to introduce the new modality of blended FETP, where we mix the online with the in-person training, and we have offered the training of the master trainers or master mentors, development of indigenous case studies that utilize the local data or national data, as well as other means of facilitating learning. I'm sure Dana will cover in her presentation. As I mentioned earlier, the role of the FETPs extended beyond the training to include responding to outbreaks and emergencies through mobilizing the residents and graduates to add to the capacity of the Ministry of Health and other partners in the health sector. Through direct, again, through direct provision of service at different level of the system. In addition, the FETPs in this region have added significantly to the production of science in this region through scientific writings, documentation, publication, and sharing or dissemination of those findings through different platforms. Again, Dana will provide more details, but as an example of our today's event, so we have this regular webinars, newsletters, conferences, and other platforms. And as I said, now we have our 13 countries in the region, expanding from 2009 up to 2022, and we expect more. So what to expect? I think the COVID-19 pandemic provided a golden opportunity for the FETP to present their case and to have more recognition, and this would definitely facilitate the acceptance and support, or mobilizing resources to support those programs. So I expect that more recognition, more commitment from the Ministry of Health, from other partners, support the program and provide the needed resources. In addition, we have witnessed the interest of new partners who were historically somehow were away from the FETP. Now the interest of those partners is growing, and I expect that in the coming few years, many partners will play again critical role in supporting the FETP program. Similarly, and using the same momentum created by the COVID-19, we hopefully will see a solution for the chronic existing problem of the ongoing discussion about the career pathway for our FETP graduates. So hopefully we will see some radical solutions for this ongoing problem. Regarding the content of the program itself, again, I expect some changes for under this category. We may see new context for our programs. Now, again, many countries, many partners start to talk about the One Health approach. Maybe we can see topics like global health, migration, climate change, and other emerging topics to be part of our curricula. Again, new competencies might find their way to our training sessions and competencies. And here I'm quoting from Dr. Chikwi, the Director Assistant of WHO, who was supposed to be with us today, but he promised to join us in future webinars. But he expected to see, again, topics like genomics, GIS, data science, computational biology, crisis communication, cultural sciences, bioinformatics, and others, because those factors actually shape the public health and consequently the epidemiology of our diseases and health problems. So maybe we can see more of those topics in our exercises, in our classes, and our practical training for the FETPs. For the modality that the FETPs presented, again, as I mentioned in my previous slides, we have just started the era of online FETP. So I expect more expansion and more advancement in this aspect, where we may witness the introduction of tools and methods and approaches like virtual reality in training our residents. Maybe we can see, of course, expansion in using the blended approach, not only in this region, but for other regions. And we have been requested continuously by other countries outside this region to share with them MFNET experience in this category. So this is again an area that that is expected to show advancement. For the scope that FETP addresses, I expect that audience from other sectors who were not part of the or not targeted by the FETP in the past, they will find place or seats in our FETP programs, including all those who work or serve under the umbrella of public health. In addition, again, we have witnessed interest from private sector to adopt and to be part of this program. So I expect some modalities to appear where the interest and need of the private sector can be addressed by the FETP. In addition, more fields beside the public health surveillance may find their way again to the program, like, for example, more specialized FETPs, especially for the basic FETP, where we can have more cohorts of areas like WASH, nutrition, maternal child health, NCDs, and other areas. For the structure of the program, as you all know, the famous pyramid where we have the basic, intermediate, and advanced level. So I expect to see maybe some additional layers, one below the basic level, where we can have a shorter version to address different audience, like what we have seen in Yemen, where the community health workers for the 2 weeks or 3 weeks frontline FETP, but also we most probably we will see more interest in basic and intermediate FETP. In addition, at the top of the pyramid, we may also have what I may refer to as subspecialty. So after completing 2 years of advanced FETP, some may see the need for specific or more advanced specialized FETP modules or courses. So those are some of the expectations and dreams that may find their way to the FETP. However, those dreams and expectations cannot be achieved without enabling factors or precondition for their success. Most importantly, the commitment and willingness of the countries, the partners, and all stakeholders to institutionalize and sustain the FETP, because we can develop excellent programs, but without ensuring their sustainability, that means nothing. So in order to continue the value added by the program and to add more, we need first to think and act proactively and seriously to address the issues of institutionalization and sustainability. Second, when we design our programs, our modules, and trainings within the FETP, we have to ensure its flexibility to meet the changing environment. Because to be resilient, you have to cope with advancement, with the emerging and changing priorities. And I think FETP is capable and is flexible enough. Nowadays, we are visiting Qatar and meeting with the Ministry of Health and other partners in order to think how to establish their programs. They have, of course, different health priorities, maybe advanced healthcare system, but still they realize the need for FETP, maybe in a different context. But this is an example of how FETP can fit all countries, all contexts. The third point that we need to consider is to revisit our indicators, our targets. So we need to plan carefully for our programs. We need to see who are there, who are in need for those training programs in order to better plan for our FETP programs. Again, in order to ensure the effectiveness of FETP, we need to invest more in research for two purposes. One, to guide the training itself. So the research will guide us in updating and customizing FETP modules and sessions, but also to inform the policy and decision-making process. Through this, again, we will ensure the sustainability of the program and we make the maximum use out of those programs. Similar impact can be ensured by maximizing the impact of FETP on service provision. And again, back to the example I shared earlier about how FETP could contribute significantly for during the pandemic, we can build on this momentum and sustain those kind of activities and support to the health system. It goes without saying that those expectations, they need that all stakeholders to work jointly to ensure the proper implementation of the program, but also to maintain the quality needed for the FETP. And for me, funding and money is one component to ensure the sustainability and to ensure the progress of the program. Despite it's important, but we need to see it as part of a whole requirement. And I know that we have limited resources, and that doesn't necessitate to sit and wait for resources. But instead, we have also to think how to rationally and efficiently use what we have already in order, again, to ensure the continuity and improvement of the FETP. So those in brief, what I expect for the FETP in this region maybe and beyond in the coming few years, and what is needed to successfully achieve those expectations. Thank you, and I welcome your comments, your questions, and debates. Thank you.
Thank you, Dr. Bashir, for this excellent overview and vision for our future, and a lot of ideas that can be experienced by all our country. Thank you for this excellent presentation. Now I will move to the next expert from our region to present the experience of his country. It is Dr. Abdul Wahid Al-Saruri from Yemen. Dr. Abdul Wahid is technical advisor from Yemen Field Epidemiology Training Program. He is a professor of community health at the Faculty of Medicine and Health Science, Sana'a University, Yemen. Dr. Abdul Wahid is a PhD holder from University College of London. He is a professor of community health at the Faculty of Medicine and Health Science, Sana'a University, Yemen. Currently, he is the technical advisor of Yemen Field Epidemiology Training Program since 2013. Dr. Abdul Wahid has carried out a number of quantitative and qualitative researches, surveys, and evaluation. He is also the author of 6 books and more than 50 articles. Dr. Abdul Wahid will share with us today the experience of Yemen FETP, the lessons and experience from the field. The floor is yours, Dr. Abdul Wahid.
Thank you, Dr. Insaf, and Assalamu alaikum, sisters and brothers from everywhere. And it is very delighted to be with you in this important web seminar. I think, first of all, we should thank Infinite. We'll be serious to learn from each other and to share our experience. Just the outline of my presentations, I will speak about country background, then I go to short introductions about Yemen FETP. Then I will give examples about Yemen FETP impact over the past decades, and I will concentrate on 4 pillars or 4 impacts. The first one in developing EBI workforce, the second leading response in crisis situations, and the third one is supporting decision making, and the fourth one is raising awareness for public health issues. Before I conclude, I will discuss briefly about some challenges facing by Yemen FETP and other programs. Then I will conclude and give a final message. If we speak about the country programs, Yemen has a population of around 30 million, with life expectancy at birth of about 66, and infant mortality is around 47. Maternal mortality is 164 per 100,000. More than 2 million under 5 children are suffering from acute malnutrition. The major problem that the protracted war and siege, which is entering it is 8 years, with that claimed more than 370 lives through both direct and indirect impact, widespread economic collapse, and overstretched social services, especially health services. Just this is to show you that every part of the life was affected and by this war. And it is sad to see that even health facilities and was also
Dr. Abdul Wahid, we have a technical problem with the sound.
regarding FETP, the first enrolled in 2000, implement epidemiological. Do you hear me?
Yes, now, but the presentation is lost.
Oh, sorry. I will share it again, okay? Sorry about this. You know, this is one of the impact of the protracted war in Yemen, as you can imagine. We have very poor connection to internet. So I'll share it again. Do you see now the presentation?
Not yet.
Not yet. Okay. Is it okay now?
Yes, it's okay. Could you go
Sorry.
to your last slide?
Yeah.
Thank you.
So as I said, the program was launched in 2011 to reduce major public health problems through developing EP workforce, to conduct a cross-cutting integrated surveillance, detect, investigate, and respond to public health problems, implement epidemiological studies, and use data for decision making. This is the training pyramid, three-tiered. We have advanced 2 years programs that launched in 2011, and we have the intermediate or the 9-month tier that launched in 2022, and we have the basic or FEB 3 months tier that was launched in 2017 with a great support from Infinite to start it. I'm going now to speak about some of the impact of our programs. And as I said, the first impact and the major impact, I think, is developing EP workforce. The programs generated a pool of epidemiologists at all health system level, and those are responsible and for outbreak investigation, surveillance, and the crisis, and they are in the front line. From the advanced tier, we have 5 cohorts graduated with 53 graduates, and the 6 will be graduated in 2000. From the intermediate, the first cohort just started before and will be graduated in early in the next year. For the front line, we have 17 cohorts graduated with more than 400 surveillance officers graduated, and the 18 cohort will be graduated soon in next month. This map showing that the spread of our programs all over the countries for the advanced tier, we nearly now cover 20 governorates from 23 country governorates. So we have a widespread. Regarding the basic tier, we also covered completely maybe 12 governorates, and partially about 5 governorates, and still we need to move to a more governorate, especially in the southern governorates, which I'm glad to say that they already started to do this. Another important thing in developing EBI workforce that we help to build capacities of more than 400 central and peripheral Ministry of Public Health staff through short training workshops in international health regulation, biosafety, biosecurity, biorisk management, outbreak investigation, rapid response, emergency preparedness and response, as well as hospital emergency preparedness and others. We are glad to say that some of the FTP graduates are in key ministry positions. One important position is the DG of Disease Control and Surveillance. The ministry is occupied by one of our graduates, also Deputy Director of Disease Control and Rapid Response Coordinators, and other programs like diphtheria and malaria control programs was also run by some of our graduates. Another important thing is that all governorate and district surveillance officers now are from these, especially the northern governorates, are FEP graduates, and they are in the front line to respond to all these emergency situations in the current situations. Many Yemen FETP advanced graduates also employed by partner organizations, although sometimes we said this is a disadvantage, but really I think it is an advantage, especially in the country where the access for the external consultants and experts becomes very difficult with SAG and war. So these graduates are more acknowledgeable about the situation in the country, and they are helping the partner organizations to concentrate their interventions. Regarding this developing EB workforce impact, we can read more about it in published papers that we publish in Eastern Mediterranean Health journals. The second major impact, I think, is the leading response in crisis situations. We are all the time in crisis situations, but in the Yemen FTP respond to more than 500 outbreaks by the all tiers, and notice the COVID-19, cholera, diphtheria, measles, dengue, and other outbreaks. And we also document our experience in 2 major outbreaks and published commentary about the role of Yemen field epidemiology in disasters, and taking Yemen cholera outbreak as examples, and another papers we published recently about the experience from Yemen in facing COVID during a conflict, and this is already on the published. Also, for this impact leading responses in crisis situations, Yemen FTP supervises and participates in many Ministry of Public Health responses and activities like polio, national door-to-door vaccination, and the nationwide measles and rubella immunizations, health facility need assessments, and distributing of impregnated nets campaigns. The third impact, I think, is the supporting decision-making, and this is one of the main objectives of Yemen FETP, and through analyzing and evaluating more than 100 surveillance systems in cholera, diphtheria, acute flaccid paralysis, shariat, rabies, and meningitis, and others, and we provide the ministry with decision makers with best evidence how to intervene in these situations. Our graduates, our residents has conducted more than 53 blinded studies on priority health problems like vaccine efficiency studies, coverage studies, impact studies and risk factor studies and evaluation studies, NCDs and cancers and rheumatic heart disease, and CAP studies also in cholera, dengue, and diarrheal disease and ORS. Also in supporting decision making, Yemen FETP supported timely and sound development of policies by participating in many scientific committees like Cholera Scientific Committee and Diphtheria and National Immunization Technical Advisory Group, Oncocircuit Scientific Committee, Influenza Scientific Committee, and COVID. And we help and advise the minister and his deputies on these topics and these regards. We also support development and participate in development of guidelines and standard operating procedures for diphtheria treatment guidelines, cholera treatment guidelines, and COVID treatment guidelines, rapid response. And this in Arabic language, which becomes very easy to absorb and by different levels and to help to improve the quality of our interventions. The fourth impact is raising awareness towards public health issues. And through this, we organized 5 national FETP conferences during the last years. More than 130 abstracts presented in these conferences with pre-conference workshops, especially in the last one, and keynote speech and roundtables. And we published also more than 170 or presented more than 170 abstracts at international, regional, and national conferences. We published more than 55 articles in peer-reviewed journals on surveillance system analysis, evaluations, outbreak investigation, priority health problems like immunizations, NCDs, and case studies. We are proud that we won CDC Director Award at the 2022 International Nights, and also win many best oral and poster presentations at Infinite and Tiffany's regional and global conferences. This is just examples of books and abstract books and journals we published in it. We also help to raise awareness through launching Yemen FETP Arabic English websites, where you can find some of our reports and outbreaks and surveillance analysis and others. We tried to launch Yemen FETP quarterly Arabic English newsletters, and we continue to publish it for more than 3 years, but unfortunately in the last years, due to some constraints, especially financial constraints, we stopped publishing it. But we looking forward to restart it when as early as possible. Just before finishing, I go to some challenge we are facing, and this is well known about political instability and war and sake and insecurity in the country. This led to limited funding opportunities and difficulties in attending regional and global conferences, in spite that we have many accepted abstracts in these conferences. Also difficult to invite external trainers and evaluators to start applying for accreditations. As Dr. Haytham touched on sustainability, and it is important, we are suffering from financial sustainability as we are solely dependent on donor funds, and another constraint is limited mentorship capacities, but we are trying to use our graduates to cover this weakness. Low graduate retention by health system, especially with a country where there are no salaries for government employees for more than 5 years now. So it is not unexpected that to see this low graduate retention. And one important thing I think is the limited uptake of our outputs and recommendations that comes from investigations and from analysis and from studies due to the difficulties and suffering of health systems due to war and the final message I would like to conclude with, that health systems everywhere can only manage emerging and re-emerging crises if having adequate and well-trained, willing workforce. While it was shown that the impact of FETP is substantial, as Dr. Haythami mentioned, recent health crisis showed that still need more EB workforce and to strengthen country EB capacity and health system resilience. So my appeal is there are growing needs for supporting countries FETP's different tiers. Thank you very much for your listening, and I welcome any comment or addition or a question. Thank you very much.
Thank you, Dr. Abdul Wahid, for this very great presentation and for sharing this excellent experience from Yemen FETP. It is really a model to be used by other countries and to enhance our capacities. Really, thank you for this great experience and for sharing your experience with us. Now we are going to move to the presentation, the third presentation that will be done by Mr. Dana Shalabi, who will present ways to increase visibility, lessons learned, and regional experience. Mrs. Dana Shalabi has been part of the EHG AmpNet team since June 2014. Within this time, she has taken several roles. She started off as a content editor, then she became a communication specialist, and later she took on the role of communications team leader. And now she is the team leader for knowledge exchange and networking within the Center of Excellence for Applied Epidemiology. Within her current role, she leads the knowledge exchange and the networking team and oversees the development of initiatives that offer spaces for expanding the organization's networks and that offer opportunities for FETP residents, graduates, and public health professionals to share knowledge and to engage in fruitful discussions towards achieving better public health outcomes in our region. The floor is yours, Mrs. Dana.
Thank you, Dr. Nassaf, for the introduction, and good evening, everyone. I just want to make sure that you can see my screen. Can you all see my screen?
It's okay.
Yes, thank you.
You can.
So today I'm going to talk about increasing visibility for FETPs and our experience from the EMR. Okay, so first of all, the first part of my presentation is dedicated to why it is we want to increase visibility. So before we start on why, I want to just define what we mean by visibility. Now, the dictionary has several definitions about visibility and what it entails. The first definition is the state of being able to see or be seen. The second is the reduction in police presence and visibility in the street. The third is the distance one can see as determined by light and weather conditions. And the fourth, which is the definition we are concerned with for the purposes of this presentation, is the degree to which something has attracted general attention or prominence. So why, based on this definition, do we strive to increase visibility for field epidemiology training programs and public health professionals in general? Because first of all, visibility equals credibility. The more we showcase the achievements of field epidemiology training programs, we increase their credibility in the region and beyond. And then visibility also equals accessibility, which means that once we increase the visibility of the FETPs, people know how to reach them, contact them, and gain more partnerships with them, which brings me to my Third point, credibility equals partnership, and partnership equals more support, more efficiency, and better outcomes in general. With that said, and as Professor Nisaf said in the introduction, based on this, TEFNIT had launched a movement called the World Field Epidemiology Day, and the World Field Epidemiology Day is a global movement. It recognizes and raises awareness of the role of field epidemiologists in practicing the health of populations and advancing global health security. It advocates for increased investment in field epidemiology training, research, and professionals. So based on this, this movement increases visibility for FETPs, and we have established that the increase of visibility is very important for FETPs in general. So efforts to increase visibility for the EMR FETPs. Now, first of all, believing in the importance of increasing visibility for FETPs in 2019, MFNET established the Knowledge Exchange and Networking Unit, which is part of the Center of Excellence for Applied Epidemiology. And the Knowledge Exchange and Networking Unit has a mission to create spaces and opportunities for the exchange of experiences and know-how. And it is founded on GHD MFNET's belief in the importance of fruitful discourse as a means for elevating public health practice. Now, visibility initiatives. What initiatives do we have for increasing visibility for FETPs? Now, there are direct visibility efforts and indirect visibility efforts. Now, for example, recently this year, we launched the MFNET Electronic Library, now, or EEL. Now, this library was launched based on MFNET's commitment to developing new solutions and building on existing ones that enable and support field epidemiology training program residents, graduates, and public health professionals in the region, as well as students. Okay. And so this electronic library targets FETP residents, graduates, and their support teams, public health, field epidemiologists, and public health professionals, and students, and anyone basically interested in public health. It serves as a resource for field epidemiologists and public health professionals in the EMR and beyond. It provides users with access to resources and tools that will advance their research and practice. It spreads public health education and information across the region. It contributes to bridging the information to action gap. And the vision of EEL is to be the most comprehensive resource hub in the Eastern Mediterranean, serving field epidemiologists and public health professionals. And its vision is to improve public health and research by providing access to information. Now, this is what EEL strives to achieve, but also EEL has a very important section in it. It is called the Infinite Publications section. And in this section, we publish what is known as gray literature, or literature that has not been published in official journals. It includes FETP publications, abstracts, case studies, reports, handbooks, and manuals. So this in itself is a space for field epidemiology training program residents and graduates to showcase their work. So in this case, in this way, EEL also contributes to increasing visibility for FETPs while also disseminating information and showcasing the work done by the region's public health professionals. Now, EEL also has other resources as those shown here. These are a few of the resources you can find on EEL. And we launched in May, and we are happy to report that we have over 400 users on EEL. Now, we have also another means for increasing visibility for FETPs in the region is the biannual conferences and symposiums that MFNET organizes. Now, what are the objectives of these conferences? These conferences basically offer a space for networking. They offer a space for the exchange of knowledge and experience. They offer a space for also showcasing the well-grounded work of field epidemiology training program residents and graduates, as they are space for oral and poster presentations. They offer a space for networking, and they offer a space for the expansion of knowledge in general. To date, EMFNET has hosted 7 conferences. Our first conference was in 2009, and it was in Amman, Jordan. Our second was in 2011. It was in Sharm el-Sheikh, Egypt. Our third was in 2013. It was in Marrakesh, Morocco. The fourth was in 2015, Aqaba, Jordan. The fifth was in 2016, Marrakesh, Morocco. The sixth was in 2018 in Amman, Jordan. And the seventh was in 2021, Amman, Jordan. And the eighth, hopefully, will be in next year, 2023, in September. We also started an experience in the year 2021, which was the symposium, the Operational Research Symposium. This was an online 2-day event in which we offered a space for field epidemiology training program residents and graduates to share their research on COVID-19 in the form of abstract presentations. It was held in April 2021, and it offered 2 days of presentations. So in this, we have these initiatives offer spaces to increase visibility for FETP's work and to allow FETPs to also showcase the work of residents and graduates. Now, on a different note, EMFNET has contributed to increasing the visibility of FETPs through the FETP newsletter. This is a quarterly newsletter in which the different country program news is published. It allows FETPs also to learn and exchange expertise amongst others. And to date, we have published 12 newsletters, and we recently are looking into publishing the Arabic versions of these newsletters as well. And another space for increasing visibility for FETPs is the EMFNET WEBi series, which this webinar is part of. Now, the EMFNET WEBi series was launched in June 2020. It strengthens relationships, it enhances public health capacity, it fosters online communication, and it disseminates knowledge, and it allows for public health professionals and experts to discuss topics of interest that are of interest to the region. This is a sample of the attendance we receive and the people on these webinars in the different countries that do attend these sessions. Okay, and we recently also adopted a different approach for the sharing of increasing of visibility through launching the FETP Ambassador Program. Now, the Ambassador Program was launched in July 2022, so it is only 3 months old, and it recruits a contact person or focal point from each FETP in the region to collaborate with the Knowledge Exchange and Networking Unit in EMFNET. And how do they collaborate? They collaborate by sharing the achievements of their country program, sharing news, and sharing photos. Sharing photos and different updates from the program. Its objectives include the strong links between FETPs and EMFNET, partnership and increasing the FETP visibility, and to increase awareness of the different work that the FETPs in the region do. So what exactly does this contact person who was appointed from each country program by the country program director do for the ambassador program? They represent EMFNET within his or her country. They are the first point of contact for national inquiries related to INFNIT. They update INFNIT with FETP country program news from different categories. They share with the knowledge exchange and networking team the achievements and publications produced by FETPs that are open for dissemination. They encourage residents, graduates, and health professionals in the region to subscribe to INFNIT's electronic library and to follow its different social media channels, and also basically to be part of different initiatives initiated by INFNIT. So they publish accordingly photos and news stories, etc. So where do we share this information? We share this information on the GHD INFNIT website, the GHD INFNIT social media channels, the GHD INFNIT networking platform, the media, the FETP newsletter, and we disseminate information across our network. So this is through collaboration. We work together with the country programs to showcase their achievements and to highlight the different work that they do. So why is sharing news and updates effective for visibility? Hardworking people usually like seeing their achievements published. They tend to share their published achievements with more people. So we believe that with more sharing, the visibility of FETPs for our region would increase. In numbers, we have 17 ambassadors from the 13 FETPs in the region recruited in the program. They come from the region's 13 FETPs. We conducted today 2 training sessions. The first was an initiation training about different communication skills, and the second was different tips and tools for the ambassadors to start producing newsletters for their own country programs. We held 5 bi-weekly meetings to date, and so far, the program has resulted in 30 pieces of news to be added to our different communication channels. Now, next year, amongst our programs include, we are looking into producing an alumni association. We are launching the 8th INFNIT Regional Conference, and we are working on revamping our networking platform, EpiShares, which will serve as a tool also to allow field epidemiology training programs to network with each other and share information. A final thought, I like this quote while I was preparing for this presentation: you can't build a reputation on what you are going to do. This is why it is important to stick to facts and things actually happening on the ground when we want to increase visibility. And with this, I come to the end of my presentation, and I'm open to any questions you may have. Thank you for listening.
Thank you, Mrs. Dana, for this very interesting presentation, very exhaustive presentation. A lot of work is done by INFNIT for the visibility of the programs. Thank you for this. We have many questions for our honorable experts and speakers. I will start by the first question for Dr. Haytham. Is the extent of FETP in our region, how to be multidisciplinary? Any best practices that could be shared for this multidisciplinary approach?
Thank you, Dr. San. I think we have examples, actually many of them, on how FETP can be or can accommodate different disciplinary professions in public health, especially when it comes to the basic FETP, or what we know in this region as FEP, or public health empowerment programs, and also the intermediate FETP. And actually, this is one of the rationale behind introducing those levels, is to give the opportunity of professions other than classic medical doctors, who were mainly the residents for the advanced FETP. So those two models, the basic and intermediate, provided this opportunity for other health professionals to join the FETP programs. And I think more can be done in this regard. I just mentioned the One Health. So maybe FETP can also accommodate those workers beyond the health sector, to include the agriculture, the animal health, environmental, or the environment and other related sectors and disciplines. Thank you.
Thank you for your answer. I have a question for Dr. Abdul Wahid. Is coming from Nada Ahmed. It's about if you can elaborate more on FETP's contribution to supporting the anti-NI tag in Yemen, as mentioned during your presentation, Dr. Abdul Wahid. I don't know if Dr. Abdul Wahid is listening to us or not. Maybe I will go back to Dr. Haytham and to give you another question. It's how do you see the future of FETP in the context of the revolution in health informatics and digital innovation? You mentioned the blended approach, and the new technology, and what is your think about this revolution in health informatics?
Yeah, I think this is an important question. I see it actually in two ways. One is to use those approaches, the technology and digital revolution, to enrich the experience of the training itself as tools, as platforms that can better introduce the program. On the other hand, they can be seen as content to be taught and to train our residents on how to utilize those advancements in fields like health informatics, in digital health, and others, or other related areas. So it goes both ways. However, we have to be careful. We need not to overburden the FETP and not to deviate from the core function of the FETP, its essence and flavor, which is mainly surveillance, outbreak investigation. But anything around those two main competencies, definitely they can enrich the program and add value for its usability. Yeah, thank you.
Thank you, Dr. Haytham. I have another question for you. It is how our current program could contribute to the public health burden beyond the communicable disease to non-communicable diseases, and how they could serve the most vulnerable population segments, such as women health and humanitarian crisis.
Yes, again, one of the beauties of FETP, as I mentioned also earlier, it's flexibility and adaptability to accommodate various needs, both existing as well as emerging needs. And we have in this region in particular, very rich experience in customizing FETP to meet those challenges. Like, for example, in Sudan, we have introduced an entire module about disaster and emergency management, which is not present in other programs. Also, we have customized a specific program for the basic FETP or the FEP, specifically for COVID-19. And actually, its title is FEP COVID-19. So using those examples, for sure, we can customize the program to address those areas ranging from maternal child health, nutrition, NCDs, and many other areas of public health. But again, we need to preserve the original or the core competencies of the program. We can talk about epidemiology of NCDs, the surveillance of NCDs, and similarly with other sectors, whether WASH or nutrition. As far as we are going with the core competencies, no harm to add flesh to this skeleton of the FETP. Yeah, thank you.
Thank you. There is another question coming from Ghada Shuna. Would you like to know what are the anticipated challenges and the proposed solution for ensuring the sustainability of FETP programs in the region with the given context?
I think if Dr. Abdul Wahid with us, he's the best to respond to this.
Okay, Dr. Abdul Wahid.
Yes,
we have a lot of questions related to the fact how you succeed to have this achievement with your program, and what is your review for the future, and also what are the challenges and how you achieve this great progress.
Thank you very much. I'm also surprised sometimes how we succeed in such difficult situations. But I think it is a mixture of commitment. We have very committed staff, and leadership. We have a very enthusiastic and supportive director of the program. We have also the political support and the ministry support to the programs. And most importantly, I think the needs. There is a need, and there is a people who are needing our service, and we should fight for them. We should do our best. We should not neglect their needs. And all these mixtures, I think, will help support. We hope that we can sustain and continue in such difficult situations. And looking forward for a peaceful Yemen, which maybe comes in the future and will help more to do more achievements. Thank you.
Thank you, Dr. Abdul Wahid. I have a question from Dana. The question is, what was the criteria of selecting the ambassador, and also how to connect to IL?
Thank you, Dr. Nitaf, for this question. First of all, the criteria is that the person who is an ambassador has to be nominated by the Field Epidemiology Training Program Director. And second of all, he or she needs to be an FETP resident or graduate. And it is every year we recruit new ambassadors to the program. So it's a one-year recruitment, and the purpose of that is to increase build capacities of as many people as possible. Now, how to register to IL? You can go to the IL website and sign up and fill in a very short registration form, and you will have access to IL.
Thank you. Another question coming from Bangladesh is there any program to start vet FETP in other countries as in Bangladesh?
Yes.
Maybe it can be for Dr. Haytham, this question, yes.
Yeah, thank you. Yes, actually, this is the trend, and we expect more requests from countries to establish their FETP vet. And I think working with Bangladesh provided us with confidence that this is doable, and definitely to add to the One Health approach for the countries. Maybe a similar or closer approach is the One Health. This year, we plan to establish two new programs under the umbrella of One Health. So as we go on, I think we will see more FETP vet programs. But sorry, Dr. Nisaf, I'd like just to have this opportunity to restress one point, because I have seen one of the question. Maybe later we can provide more details, but the private sector, yes, shows interest in having opportunity to be part of the FETP. However, the model for sure will vary among countries based on their regulations, the systems there. But the rationale is there. We need to just to think how. Yeah.
Thank you, Dr. Haytham. Another question is there any plan from ANFNet to support and enhance publications related to FETP studies? And what are the criteria for selecting FETP resident, and how to apply for the program as a resident? Two questions related to the to publish results from field activities and how to become a resident.
Actually, this is what we are doing, and this is one of our mandate to support publication. We have done a lot. Maybe in the coming webinars, Dr. Yusuf might have the opportunity to present our efforts in this regard. And for the questions related to the programs, it is solely the responsibility of the country. So whoever asked the question may contact his or her FETP director in their respective countries. Thank you.
Thank you for giving these answers. It was a great opportunity today to have this webinar to see what is the future of FETPs. FETPs were very important in the health system, and it was shown that they have a big role to respond to crisis and to respond to pandemic. We have seen that new technology is one of our future, and to use new technology to avoid the interruption of FETPs and to enhance the enrollment of residents and the enrollment of different programs. Dr. Haytham giving us very nice presentation on the future, how to maintain sustainable our programs. A lot of ideas coming from Dr. Haytham related to this, and we need to integrate our programs in at country level, and we need to have more visibility as part of the sustainability of our programs as indicated by Dana. We have seen a very good experience coming from Yemen Field Epidemiology training program with a great achievement to be as part of the decision making. The program conducted a lot of research activities, a lot of publication, and it was very helpful for the system to enhance the capacity to respond to different emergencies in a difficult context. We have seen that we need flexible FETPs. That means we need to adapt the FETPs to different contexts and to be open to other sectors. One Health approach is the future, as the most pandemic are related to One Health approach, and it was a great idea to introduce the One Health approach in our FETP's program, and more than the One Health approach, the global health security also, as mentioned by Dr. Haytham, is part of our programs. Our programs are not only what was presented by the pyramid, the classical one, from the frontline to the intermediate to the advanced. Dr. Haytham shown that we can have more than advanced, the post-advanced program, and the initiative of our region, and we are very thankful to ANFNet and GSG ANFNet for being the leader in FETP development and FETP expansion, with this opportunity to have the post modules, post advanced FETP opportunities. All of us participated to different modules and different opportunities, and today I invite all participants from our region to follow the webinars and the regional conference, and also the different opportunities offered by ANFNet, GSD, who are supporting our region in different domains. And we have to say that we initiated a lot of new experience in our region, innovative experiences in our region, and we are proud of what we are doing. And we need more commitment from our countries to sustain our programs. We need more commitments from our residents to be involved in different programs, and we need not a lot of commitments from donors to sustain the funds for these programs. It was shown that the role of FETPs is very important in crisis management. They were in the front line doing the field activities, but also they were in the very high position to give the response guidelines for the decision makers. It was shown that FETPs are in the core function of public health, and we need to sustain these FETPs. Many thanks for all of you for giving us this opportunity to see the future. We need to construct the future together, and we need the commitment of all of us to construct our future in a better way. Thank you a lot for this opportunity.
Thank you, Professor.
Thank you.
I give you the floor for last comment. If you want to comment, Dr. Haytham, Dr. Abdul Wahid, Mrs. Dana. We have 10 minutes.
Thank you, Professor Nisaf, and I just want to again congratulate Dr. Abdul Wahid and Yemen FETP for the great work. But this example is not just seen in Yemen. Actually, all FETPs in this region, they showed how dedicated they are towards their mission and to support their health systems and their population. And we are proud of each and every FETP in this region. My second point is that I would like to apologize for not being able to respond to all questions in details, but as we usually do, for sure in our report that we will disseminate after this webinar, we will try to answer in detail all those questions, and we welcome more ideas to add to what have been presented today. Thank you.
From my side also, I would like to thank Dr. Insaf and other presenters and Infinite for running these important webinars. I just want also to stress what Dr. Haytham said, that we are not a unique programs. We are part of the regional family, and every country's FETP is doing what we are doing. Maybe the crisis which is around Yemen make some sympathy with our programs, just that, but still other programs are doing maybe better job than our program. Thank you for all programs, all FETPs, and all graduates and residents. Without them, we cannot do anything. Thank you very much.
Thank you, Dr. Abdul Wahid. Thank you, Dr. Haytham. Thank you, Mrs. Dana, for your time and for giving this very interesting presentation. We hope the best for our FETPs and for the global health security, and we are very happy to take part of this webinar. Thank you for all of you. Thank you for all participants for your attendance and for your questions. And as much as by Dr. Haytham, you will receive all the answers and a report of this webinar. Thank you. Now we will close the webinar and see you next time.
Thank you.